A second.
We.
Where am I correcting my impression? Got it. Say that again one more time.
What are the most common requests you receive from patients?
The most common request that I get from patients is tightening and lifting of their skin, filling under eye hollows, and just overall making their skin and their face more contoured, more lifted, and more aesthetically youthful.
Are you seeing that women are now striving for a natural look?
In the past, hold on, let me zoom in again. My patients are definitely striving for a more youthful look. In the past, most people had a lot of work done, but didn't want anyone to know that they had it, and they looked overdone. Nowadays, patients want to say that they've had a lot of stuff done, but they want to look very natural, subtle, contoured, and prevent the aging process, so they start their treatments early.
Is there a motion women make to show the results they're looking to achieve when they get InstaLift?
The motion most of my women make when they want to make, the motion that most women make when they want an improvement with InstaLift is the upward motion. They're always pulling back because they want a more lifted look.
What would you tell patients about the current trends or procedures on the market?
Well, the trend nowadays for most women is a combination of treatments to get better results that are more youthful, more subtle. People are looking for a lifted look, more contoured and natural, and so we're combining things like fillers, toxins, and peels with new technologies like microsuspension with threads to give lifting and contouring and prevent the aging process or slowing it down, and that's really in a combination fashion. Rather than doing a lot that's overdone at once, we're doing a mixture of things to lift, to tighten, to tone, and to fill volume at the same time.
Do you feel that, how do you tell when a patient is ready to level up from injectables?
That's an interesting question. You can tell, you can tell my, I answered that because it's not really great. Let me say who's a better candidate. Let me say better. No, I know, but I'm saying that I would repeat the question. So, do you have to specifically say that question? Okay.
No, if you feel something's better, you can totally do it.
How do you know when somebody's a good candidate for the InstaLift procedure? My patients who have had fillers and done lasers and other skin tightening treatments and still look like they have some sagging, or the fillers look overdone, they have excessively large cheeks or over-defined features, those are the candidates for lifting procedures so that you can limit the amount of fillers or complement the fillers with the internal tightening and lifting that we would get with the threads. My patients that have a heavier mid-face or they're starting to notice some sagging and you're overusing fillers to give lift or volume, those are the people where you want to stop using the fillers, you want to slow down the amount you use, and start doing threading procedures to tighten and lift the tissue, because typically you want to use fillers for volume, but not for lifting. And in this case, the InstaLift threads can really give a lot of lifting and reshape a person's face and tighten it without looking overdone.
What makes Silhouette InstaLift unique and stand out from other treatments?
InstaLift is a really unique procedure. It's a bi-directional type of threading, meaning that you can go in multiple directions. You enter through one site and you can tighten the threads and lift in multiple vectors of the face, unlike other threads that are in one direction that can literally shear through the tissue. InstaLift has little cones on it that go under the skin, and through one little insertion site can basically contour and lift areas like the mid-face, lower face, and neck, and get a lot of tightening in that area. And it's really unique because we can do it at the same time. Since this is under the skin, we can combine with lasers, microneedling treatments, and peels to give textural improvements at the same time that we're lifting, or we can add fillers if we want to kind of contour and shape with the threading. So overall, this is one of the most unique tightening procedures and should be done earlier in life to prevent sagging and give more contouring to the face.
Why Silhouette InstaLift is a technology people should pay attention to?
Like I said, so InstaLift is a technology you should be paying attention to, because as we're evolving with cosmetic treatments, most people want a subtle, natural, more youthful look. They don't want to look overdone, they don't want to look disproportionate, and they don't want to have features that are too enhanced. And by combining lifting with volumization like fillers and textural improvements, we get a more subtle look. You also prevent the aging process earlier if you do skin tightening, And with collagen production that you get with threads, you improve the texture of the skin too. So by adding this in as a newer treatment modality for lifting, along with your fillers and your lasers, you're gonna have a more natural look, one that's more proportioned to the face and looks better as you age.
Would you say that Silhouette InstaLift is an ideal treatment to bridge the gap between the needle and the knife?
That's cute. That's really cute. So InstaLift is a great treatment to bridge the gap between needle and knife. So for patients of mine that don't want surgery but want to get some improvement in lifting, we can use threading earlier on to give tightening of certain areas like their middle face, lower face, and neck. But also that can limit the amount of fillers and other things that they're using that could potentially make them look overdone or frozen in look. And so it's a nice sort of gateway in between having to do overly done treatments with needles like fillers, but also to get tightening without having to undergo surgery.
What are the results you can expect over time with Silhouette InstaLift?
So Silhouette InstaLift gives some amazing results. Initially, you'll see some immediate lifting in the areas that are being treated, such as the middle face or cheek area, lower face around the mouth and the jowls, and also the neck and jawline. Over time, however, the cones and the threads really embed into the skin and build collagen. So you get tightening of the area, you get improved profile and contour, and you also get textural improvements in the skin because the collagen production causes new baby collagen to form, so wrinkles can even improve.
Why would you recommend Silhouette InstaLift over other treatments?
About that, everyone on live. InstaLift is recommended to me as one of my #1 treatments for patients because it's subtle, it has minimal downtime, and it gives a lot of tightening and collagen production for a really good amount of value. It lasts up to 2 years. You get a nice degree of tightening, and a lot of my patients want to look subtle and natural. They don't want to look overdone. And if fillers are done too much or using toxins and you're overly frozen, that's a more unnatural look. By combining threading along the InstaLift threading along with our other treatments, we get a more natural look, you get something that is preventative over time, and you get nice contouring. Everybody is looking to be more chiseled and more defined, and you can't do that with just fillers alone. To create structure and lift, we have to use these internal threads to get tightening of those areas, and we can get just a more natural, toned, tightened look that's preventative for over time.
Great. And lastly, what would you tell someone who is considering Silhouette InstaLift?
I would tell anyone considering InstaLift to start early because as you age, the sagging process kicks in very quickly, especially in patients 25 to 35. As hormones change, you have kids, your body, you exercise a lot and you lose weight, you sort of fluctuate in weight, your skin can start to sag. And there's not many treatments that actually help lift the tissue and tighten sagging tissue. Fillers cannot lift tissue. They can give some contour and fill lines, but they're not the main treatment to tighten and lift the area. You need energy-based treatments like microneedling, radiofrequency, or lasers combined with internal threads like the InstaLift procedure to really give you tightening, contouring, and long-term collagen production. So the earlier you start this, the better. However, if you're all the way have a lot of sagging, or you're much older, you have more sagging, but you don't want to undergo surgery, and you want to get some improvement, you want to improve your neck contour, some tightening in the tissue, you can use InstaLift because it's very safe, it's going to build collagen over time, and it can be completely tailored to exactly what you're looking for. Whether it's a cheek lift, or improving the jowls, or helping the neck, we can basically do this on anybody for any of the main conditions of sagging. It's extremely versatile, safe, and has minimal downtime. Good?
Yeah.
Bye, guys. Cool.
Right on.
All right.